I'm there 'cause it's getting harder and harder to breathe.
Well, coffee and cheese seem innocent enough, but they could be responsible for relationship breakups or even lost job opportunities.
They're actually two of the major causes of bad breath, and yet probably a lot of us have them every day. So how do we fix the problem, and how do we tell a friend that they need some mints or maybe a box of mints? Expert Jeffrey Speiser joins us now. Good morning to you.
Morning, Larry. Morning, Kylie.
OK, take us through the main causes of bad breath then.
Simply put, bad breath is caused by bacteria that live in the mouth and the throat. Now, what they're doing is they're taking everyday proteins such as dairy, bleeding if your gums bleed when you floss your teeth, and just mucus in the back of the throat, coffees, alcohol, things that we love. They're basically breaking them down and giving off smelly waste products.
Are there different types of bad breath?
Yes, there are. Basically, smells that come off the tongue tend to smell like rotten eggs. It gets a bit gross.
Yeah, it does.
If you have any sort of issues with your teeth and your gums, you tend to get more of a fecal smell from there. And if you have a collection of mucus in the back of your throat, you tend to have rotten cabbage or gasoline type of smells from that.
Now, these are not odd items. You're going to find these pretty much in anybody's fridge. The eggs,
correct.
the cheese, the dairy, the soft drink. Are some people more prone to it, or is it all about these products?
There is a hereditary factor to it, but at the same time you have to have the lifestyle issues. There's a theory going around that when your mum and dad give you that first kiss when you're born, that's the bacteria that you're set up with for life.
Really?
You're kidding.
Truly.
No. You serious?
Truly. But bacteria alone's not enough. It's got to be food source as well. It's got to be those lifestyle things plus the bacteria.
Okay, so how can you tell if you have bad breath yourself?
Look, difficult. From a personal point of view, what you'll do is you'll look to see whether you have a sour or metallic taste in your mouth, because the sulphur compounds actually do taste. You'll have a chronic coating on your tongue. You may find that your floss smells when you floss. But, you know, the only positive way to know is to actually get a breath test.
So doing this in your own hands isn't, because you only smell your hands, don't you?
You smell the sweat on your hands, that's correct.
Okay, right.
So what are some ways to avoid bad breath, apart from avoiding these foods that we eat each day?
Well, a couple of simple things you can do is if you were to floss and clean your teeth every day, as my old college professor used to say, clean the teeth you want to keep. Right, so it doesn't have to take you too long.
Okay.
All right, so clean and floss twice each day, don't smoke, avoid dairy like the plague, clean your tongue every day with a tongue cleaner, and if you can flush your nose and your throat with saline once or twice a day, that's going to help a lot as well.
How do you flush your throat with saline? You mean gargle?
No, saline nasal spray. You can flush it through your nose and it'll go down the back of your throat and just clear the mucus.
Oh, the ones you buy from the chemist?
Yeah,
okay.
yeah.
Gee.
Right. There's an etiquette issue here too. If there is a friend or a colleague who has a problem, how do you go about telling them?
TLC. Tell them, lead them to treatment, and be very caring and compassionate with them.
Okay. And many cases that you see, are they easily solved, or are they...
Definitely.
Okay.
Right. It's about diagnosis, easy treatment.
So you talked about this mucus at the back of your throat. How would you treat that, for example? Nasal
flushing and avoiding dairy. Dairy actually makes more nasal mucus. So if you keep away from dairy and you were to flush your nose every day just with straight saline, you'll find that fixes that.
Now, you made a point about these tongue scrapers. Reach across. Now, you say Australians don't tend to use these.
No, it's not an Australian pastime, but it's a fantastic device.
It's kind of interesting looking. And you just use that as a scraper.
That's a travel one. That's the
travel one.
That's the travel one, so you can keep it in your pocket.
Yeah, and you can use it as a shoehorn when you're done.
That's right.
And is this the one that you have in your bathroom?
That's the one you have in your bathroom.
Okay, and you can just get these from the supermarket, right?
Look, they're hard to find around here. Most breath clinics will sell them.
Right.
In America, you can go into any supermarket and find them, but here, no.
Now, I said to you, what about just brushing your tongue with your toothbrush? I do that. That's not good enough?
No, look, the tongue has a lot of papilla. Toothbrush tends to move...
Sorry, a lot of
little papilla things that, you know, basically the food traps down under it. So what happens with a toothbrush, it'll move the sulphur compounds around, but it doesn't actually clean them off.
Right, so
but you scrape one of those down your tongue, you know.
And what about just a mint? Good or bad?
Sugarless. Sugarless mints are okay. Mints with sugar are not okay.
Oh, gee, we've learnt so much this morning.
And what about like a gargle, a throat gargle?
Be careful about any sorts of gargles and mouthwashes. You've got to make sure they don't have alcohol and they're not made with acid.
Because that will affect the enamel on your teeth?
Well, the alcohol will dry your mouth, and the bad breath bacteria love dry mouth, and the acid will affect the enamel on your teeth, but also brings up more bad breath bacteria.
Why?
Really interesting. Thank you very much. Good
Been
to
my
see you,
pleasure.
Jeffrey.
Thanks,
Really
Jeffrey.
appreciate
Thanks,
it.
kindly.
And will you leave one of those industrial tongue scrapers for me? Is that
You can have them all. I want to hear your
Oh.
feedback.
Yeah, so after I ate the eggs and the cheese with the milk, I'll give you a call. Let you know how we go. Thank you very
Thanks,
much. Good to
Jeffrey.
see
Thanks,
you.
Larry. Thanks.
Okay.
Stay with us. We're back with more of the morning show straight after this.